Hi, my name is Melanie Ragland. I'm 27 years old and I purchased my own health insurance. To me, the whole issue of healthcare reform is very, very important. As someone who buys my own insurance, I have seen my personal premium increase by $60 a month over the past 2 years. It is becoming extremely unaffordable, and in addition to that, I have found that even though I have insurance, what I pay for, which is in excess of $200 a month now in premiums, still does not cover many of my basic health care needs. So the situation that I've been facing frequently over the last couple of years is paying an extremely high premium every month, then going to get the services that I need, trying to tap into my insurance to pay for those services, but they don't cover them, and they don't cover them enough, and I'm still left with exorbitant amounts of debt to the places where I get my medical care from. That indicates to me that something is very broken about our healthcare system, and I'm someone who actually can afford, at least right now, but barely, to pay these premiums. But I know that there are millions who cannot and who are therefore going without it. So I think that healthcare reform is very important, not just for the millions of people that are uninsured, but for those of us who are insured and are barely insured and are trying to hang on but still can't get what we need. That means that something needs to change, and it needs to change now. Is it better to do nothing now and to continue with the system that we know is broken, or to try to do something to fix it?
My name is John Bowman. I get health insurance for myself and my family through work, through a pretty significant payroll deduction. My son just graduated from college, bless his heart, we're very proud of him. But one of the sort of side effects of graduating from college is that he lost his coverage as a dependent under my policy at work. So he's uninsured, he has no health insurance. I'm not willing to tolerate that, and so I went shopping for a policy, and the only one we could find that I could afford, since he's not employed yet, is cost me, a significant amount each month. It's a $500 deductible policy, so it, for practical purposes, doesn't cover any primary care, and it on its face doesn't cover any well-person care anyhow. There's no preventive coverage in there at all. So essentially what we're covered against is if he has a very difficult accident. He's starting to worry about it, even though he feels fairly invincible. And it's going to affect his, choices of his activities and his, his work activities. And also his peace of mind and ours. And I just wish there was a way that every person in this country, especially the cheapest ones to insure, like these young adults, would have a way to get affordable, decent coverage. This is America. Why can't we do that?
Hi, my name is Jamie Stathos Vandervlemen. I'm 22 and I'm living without health insurance. I used to work in a department store in retail, and I was covered by their health insurance, but I recently left that job because I found something that I love a whole lot more, which is dog walking, and now I have no health insurance whatsoever. And I clearly don't have the money to afford my own health insurance, and my parents are both self-employed, and I know how hard it can be to get health insurance, self-employment health insurance through big companies like Blue Cross Blue Shield. It's way too expensive. If I had health insurance, I wouldn't have to worry about getting sick, going to the doctor just to make sure. If I come down with a cough, I wouldn't have to self-medicate. I could just go to the doctor and check it out, and if it's like strep, I could get it taken care of. Right. So young, I think health insurance should be a lot cheaper for me than I know it would be getting it on my own, because I'm basically a healthy person, and there's no lifelong chronic condition, so it shouldn't be hard to insure me. And I think it's ridiculous that I would have to pay so much just in case I get sick.